A topic that we know a lot of you are passionate about, the impact of the pandemic on mental health, specifically children. A new survey of educators puts a spotlight on the need for more support for their students as things are returning to a semblance of normal right now. The survey comes from a group called First Book. It's a nonprofit that's geared toward advancing education equity. The group asked nearly 1,000 teachers questions about their students' mental health. While 85% of them said they think supporting students' mental health in their class is a high or even emergency priority, only 20% of them said they think they're adequately prepared to do it themselves. The psychologist who worked on this study says that just because schools are now more quote-unquote normal doesn't mean the work is done.
We do know that this is another change, another adjustment, and change and adjustment is hard and stressful. And again, we've seen trends before the pandemic that mental health of children was not doing well. So if we look at the past and the past trends, that tells us that this may continue unless we start making some significant changes to support children.
Those changes, First Book says, include a free educator resource that it's put together to help teachers be better prepared to deal with these types of issues. We asked if that should also include schools bringing in people more specialized in these kinds of issues.
The resource that we created is not meant to replace the need for child life specialists and those professionals that can address the mental health and some of those challenging behaviors in the classroom. But what it does do is allow the educators to feel more equipped and prepared to spot the signs of changed behavior, have conversations with their students in their classroom.
If you're interested in checking out this guide, if you're a teacher or just want to see it, you can find more at firstbook.org.